session of the Center for Human Rights COVID-19 Discussion Forum. This is the fourth session of the discussion, and over the last weeks, we have had significantly insightful discussions of various topical human rights issues in this COVID era, considering exacerbated vulnerability during COVID-19, threats to human rights, and the economic as with the trade impacts of the COVID-19 pandemic. Please kindly go to the Center for Human Rights webpage on www.chr.up.ac.za to get more on this significantly insightful discussion series to be fully informed on the human rights issues in this period of COVID-19 pandemic. Also would kindly ask that you keep checking for regular updates on the Center for Human Rights social media platforms in order not to miss the dates and times of these interesting discussions. Today, we are considering a significantly insightful issue, looking at the impact of COVID-19 through the optics of national and international perspectives. And our panelists today are Mr. Essa Njie, who is a lecturer at the University of the Gambia and an MSc Fellow at the African Leadership Center at the King's College, London. Also, we have Ms. Naitore Nyamu-Mathenge, who is the head of the Kenyan Office of the Physicians for Human Rights. Also with us is Dr. Adrian Juko, who is the Executive Director of the Human Rights Awareness and Promotion Forum in Uganda. And with us is Mr. Berry Nibogora, who is the Program's Director at ABSHA, and also a member of the Ethics and Governance Committee of the Global Fund. Our seasoned panelists would each have 10 minutes to make an excellent presentation. During this period, please, dear participants, may I kindly ask you to pose your questions using the chat box. Following up presentations, and you may kindly also indicate your desire to ask a question specifically by raising your hand on the Zoom application, and you'll be given the floor to ask your pertinent questions. For now, please kindly let me ask you to turn off your videos and microphones so that we could kindly pay attention to our seasoned panelists. And to start us off this morning is a discussion by Mr. Essa Njie, who will be speaking on COVID-19 and its implications in the Gambia, focusing from a human rights perspective. Mr. Essa, please, you have the floor.
Thank you. Should I put my video on?
Please go ahead.
Okay. Thank you very much, Romola. I'm glad to be part of this session to present on COVID-19 and its implications in the Gambia from a human rights perspective. I'm aware that I've just 10 minutes, which is quite short, but I will try as much as possible to not to break the rules. Anyway, so basically the COVID-19, as we are all aware, struck in December 2019, last year. And the pandemic have had a major political and socioeconomic impacts around the world. I personally will say that, the implications of, COVID-19 has been ignored by the world to some extent, because at some point, I think some countries, especially the great powers, I will say, we are busy on, in some issues that they think were more relevant to them. So when you come to the UK, the Brexit was what preoccupied, the British government. China and America in their trade war, amongst other things. So basically, the implications or the impacts of COVID-19 was ignored by the world initially. So what is at stake for Africa, especially a small, tiny country like the Gambia? This is what prompted my presentation, looking at the implications of COVID-19 from a human rights perspective. So I'm looking at the right to health, its implication on health, also on the right to food, as well as employment. These are basically my point for focus of discussion, but also I will, to give a fair balance or a balanced argument presentation, I will also look at the response of the government on these particular issues, whether they've really addressed those human rights concerns or not. Now, the right to health is very fundamental to human survival, as we all know. and various international human rights instruments, including the Universal Declaration of Human Rights of 1948, have at least outlined or guarantee the right to health of every individual in every part of the world. But in the case of the Gambia, we have a very poor healthcare system, as we all know, and this continues to provide further evidence that more people are at risk of losing their lives if they should be subjected to infection from COVID-19 virus. As we speak, we have up to 23 cases. It's a very small country. Someone might say, oh, 23 cases, nothing compared to 1,000 plus in Nigeria. But remember, Nigeria has up to 200 million people, and the Gambia is just a little above 2 million people. So 23 cases is something. So far, we have only one death, which is a bit scary. So the implication is that access to treatments of chronic illnesses such as high blood pressure, tuberculosis, HIV, AIDS, amongst others, will be reduced, putting more lives at risk. As we have witnessed in Liberia, Sierra Leone, when Ebola broke out, what happened was that people could not get access to other treatments or treatments of other chronic illnesses because the healthcare system or the hospitals and the healthcare centers were inundated with patients of Ebola. So this is also something that has, some people when they get to the hospital to receive treatment or, complain of other sicknesses, they have had experience of where they've been given proper attention because the attention of the healthcare workers, including the doctors, were paid more on COVID-19. So elderly people also continue to constitute a marginalized demography in the Gambia and Africa by extension. We all know that, from records or death tolls that we have received, elderly people are considered to be at risk or higher risk of infection and also, death. So in the Gambia too, this is a problem. And as a result, we need we need measures from the government in fulfillment of the country's human rights obligation, especially in relating to the protocol to the African Charter on Human and People's Rights on the rights of older persons in Africa. So this is to say that our healthcare system is just weak, and as a result, the COVID-19 kind of exposed us as a country to remind the government also that we need better healthcare system in the Gambia, and this is something that is not peculiar in the case of the Gambia, but I think Africa as a whole. So then the other aspect is the employment, right to employment. This is something that is also guaranteed in many human rights instruments, as we all know, including the International Covenant on Economic, Social, and Cultural Rights. Employment, but there's a link between the employment, human rights, COVID-19 implications on employment and risk of child labor. I've created this link. That is that, we all know that the pandemic has led to, job loss in many parts of the world, including Africa. And Human Rights Watch reported early this year, in around March this year, that the widespread job and income loss and economic insecurity among families are likely to increase child labor, sexual exploitation, amongst others. So it is reported 162 million children globally were bettered in child labor prior to the eruption of the COVID-19 crisis, with 73 million involved in hazardous work. Now, the link is that research suggests that financial shocks experienced by families because of parents' loss of employment, illness, among other socioeconomic challenges have a direct correlation with child labor. How? That is, when parents lose their job, they're no more receiving income. What they do is that they send their children to go out and at least maybe sell in the streets or try to at least bring something. So in a sense, children become the breadwinners of families in those difficult moments because parents are no more having access to finance. They're having either they are sick or they lose their job. So they tend to send their children out to go and fed for the family, which is very unfair, which is child labor and could result in child sexual exploitation, which is a very big issue in the Gambia as we speak, especially in the tourism sector. So the other aspect is the right to food. It is evident that one of the effects of the COVID-19 pandemic is potential food crisis. Article 25 of the Universal Declaration of Human Rights recognizes the right to adequate food and freedom from hunger, while Article 11 of the ICSCR recognizes that every person should have access to improved living standard, including the right to food. And states are obliged to take measures that will, within their available resources to fulfill these and other rights, even though these are considered second generation rights, forming part of economic rights. Now, in the Gambia, the 2015-2016 Integrated Household Survey estimated that 55% of the population are unable to meet the required calories of 2,400 per day per person. Equally, we have a population growth of 3.2%, which is a recipe for poverty, hunger, and malnutrition. And a national emergency food crisis could occur during this period of global health pandemic. Now, quickly, there has been response from the government when these things, when the virus started, as countries began to prepare for the implications or the impacts. The government decided to set up a national novel coronavirus preparedness response plan. Part of that was to make sure that social distancing rules are enforced. And a motion was taken to the parliament. Initially, the government declared a 90-day state of emergency, but parliament decided to reduce that to 45 days to say 90 days or so, because people have been complaining as well. If you ask people to stay at home, not to go out, to maintain social distancing, how are they going to feed their families? How are they going to feed their innocent children? And the argument I've given personally is that if people stay at home, okay, if they don't die from corona, they will die from hunger, which is a problem. Now, in terms of health, the health aspect of it, the right to health, the government responded, and then, okay, this is a positive step. Some people said, even in the healthcare sector, people that I spoke to said that, the COVID-19 has kind of strengthened the Gambia's health system, because at least what we have seen was that there have been improvement in centers, healthcare centers have been renovated, lab equipments and more medical materials have been bought as a result of COVID-19. So meaning $32 million have been injected or given to the Ministry of Health to prepare as a response mechanism to the COVID-19. In terms of food, also, food relief package has been, given by the government. $700 million have been allocated to this particular relief. That is 80% of the population have to benefit from the food relief. That is include rice, which is staple food in the Gambia, sugar, and also cooking oil to help families or vulnerable families at least to meet their basic needs. However, there has been controversy surrounding this as well, because the $700 million that was allocated by the government was done through Parliament, and Parliament has indicated clearly to the Minister of Finance that itself is fraud, is illegal. They should not have done that without going to Parliament. The Parliament had to approve this. But just as usual in Africa, business as usual, the government justified to say that, okay, this has been happening in the past and they consider it normal. But, according to Parliament, this is wrong and the government should not have done that. Which also it's a sign of at least a strength towards our democratic system, to say that at least we now have a parliament that will challenge the executive in some of the decisions that it does. This is quite different from the era of Jame in the past, when environment have been taking place, and so nothing will come out of it. So, but people have also been complaining with regards to this response from the government. $700 million has been allocated, but some people have said they have not seen anything yet from the government with that rise in food. And in fact, we have seen corruption emerging from this, because 2 soldiers have been arrested for stealing, rice that was meant to be given to vulnerable families or affected families. But I will also say that societal response has also been great. Not only the government, but individuals, philanthropists, Gambians have been coming out, also giving food relief packages or aid to vulnerable and affected families, people who cannot really meet their survival needs on a daily basis. And this has been tremendous. So I think the level of societal response has also been great, not only from the state, but the people as well, individual citizens. So in terms of education, the government has also taken a step towards that. COVID-19 has an implication on education, we all know. And one of those steps is that TV classes for primary, junior, and secondary schools have been launched. And online classes for the University of the Gambia has also been launched. This is for the first time. Many people doubted this, that it was going to happen, but the university decided to come up with the initiative, and the government decided to, render help in hand by providing some amount of money that is going to help university students continue with their online classes. Also, financial assistance is reportedly, let me say this reportedly clearly, I'm on record, that there is going to be, financial assistance to Gambian students abroad. I'm a Gambian student abroad, but I haven't seen anything yet. They said those on government-funded scholarship will be allocated $16 million, while those on non-government funded scholarship will be allocated $12 million to 836 students, and that 12 million will be shared among them, which everyone should be allocated at least $300. But this is something we are yet to see. So basically, this is my presentation looking at human rights, implications of COVID-19 on human rights, from the right to health, which is a bit worrying in the Gambia. As I said earlier on, we have a weak healthcare system, which could expose the more people to death if they should contract the virus. We also have the issue of the right to food, which is still a major problem in the Gambia as a result, because the cases are increasing by the day. They are not reducing in the Gambia, instead they are increasing by the day. And people are beginning to get worried by the day. In fact, the state of emergency that was declared will end tomorrow, and Parliament has already considered that they will give an extension. We don't know whether it's going to be another 45 days, which is just going to, we don't know what will be the implications again. Then on the right to employment, which I've also talked about. And finally, I've talked about the response of the government in terms of right to health, right to food, employment, education as well. So in terms of employment, there has not been any significant response from the government to ensure that people that have been affected are given financial relief packages to help them sustain themselves within the during this difficult moment. So I hope I've presented within the time frame. Thank you very much. Yeah.
Thank you very much, Mr. Essa, for that excellent presentation and for really taking us through the situation in the Gambia, highlighting the impact of COVID-19 and its implications on human rights, focusing on the right to health, but then more importantly, the right to food, employment, and the right to education. That was an excellent presentation. Thank you so much for that. And I do know that our dear participants would have very imperative questions for you, hopefully at the end of this sessions after hearing from all our other speakers. Thank you for that excellent presentation. So we move on to Ms. Naitore Nyamu-Mathenge, who will be speaking to us about the impact of COVID-19 on the right to health and sexual gender-based violence in Kenya. Ms. Naitore, you have the floor.
Thank you so much, Romola, and for this opportunity just to share my ideas around the impact of COVID-19 in Kenya, with a specific focus on the right to health and also gender-based violence. So the first case in Kenya was confirmed around the 12th of March, 2020. That's about 2 months ago. And since then, we've seen more cases being reported or being confirmed. And as of yesterday, we are at 737 cases of COVID-19 in Kenya. And of course, just like any other government subsequent to these cases, the government of Kenya put in place a couple of measures to suppress and contain the spread of the virus. And some of these measures include restrictions on movement, a 7 p.m. to 5 a.m. curfew that has been ongoing for a couple of months now, and also restriction of movement to different parts of the countries. Where there are a large number of cases, then you cannot get out of that county, or you cannot get in, like in Nairobi. And these measures, although very well-meaning, they have had some ramifications, and specifically on other rights. And just if I can just take a few minutes to speak on the right to health. Prior even to COVID-19 pandemic, the healthcare system was still overly burdened because of whatever they were dealing with. That the other ailment or access even to healthcare was still an issue prior even to the COVID-19 pandemic. With the COVID-19 pandemic coming in and being responded to and being addressed, the government, of course, has shifted its focus and priorities. The focus now being addressing COVID-19. And that means that access to healthcare becomes problematic, because even with the curfew that's ongoing, if you have an emergency at night, you're not likely to rush to a healthcare facility because you fear being arrested. And that has happened in Kenya. It has also has an impact on maternal healthcare. Home births may not be viable for all women, especially those who have high-risk pregnancies. And therefore, in time when a woman needs to access those services at night or post the curfew time, then they cannot access healthcare at that time. It's not available. As you know, the principles for accessing availability and quality healthcare, those ones have really been hampered even as we try to address COVID-19 in Kenya. Sexual and reproductive health, that's another factor. That's another service that has really been impacted in Kenya. And access to contraceptives, not accessible anymore. Most women and girls, or the girls who are in schools are closed at the moment, they cannot access. Some of them would get those contraceptives in schools. At the moment, they cannot access them, or they would be in a position to go to the nearest healthcare facility and access them. They can't do at the moment because of the confinement that's ongoing. And also, the restrictions is that if you really need to go out, you must have a very good and reasonable cause for you wanting to go out. And if you are at home with your parents, for many, or even for many adolescent girls, or for even women, having to go out, it means that you have to make an explanation to whoever that you're staying with. So it's really hampers access of these services. We've also seen some of the healthcare facilities that responded to sexual and gender-based violence being facilities that are specifically handling cases of COVID-19. And also the other factor in as far as access to healthcare is concerned is the fact that most of these health facilities, if you are visiting a health facility at the moment, they are doing screenings at the entrance, yeah? Even if you're going for whatever other services, they are undertaking screening, and most people are afraid to go to a healthcare facility because they are afraid that the screening that's being done is for COVID-19, and that's not the reason why they are going to the hospital. So they don't see why they have to go through a screening. And of course, we do understand that these are measures that are aimed at just suppressing or containing the spread of the virus, but it has implications on other human rights aspects. In as far as GBV is concerned in Kenya, the cases have spiked, and this is something that has been acknowledged by different arms of the government, but an acknowledgement is not sufficient. There needs to be much more that is done. And most of these cases of gender-based violence are intimate partner violence. So women and girls who have been disproportionately affected by gender-based violence are living or staying with the people who are abusing them, their perpetrators. There is nowhere where they can seek recourse. Shelters and safe spaces in Kenya are very few, and the ones that are in operation at the moment, they are run by private entities and non-governmental organizations. So this pandemic just has exacerbated the already existing inequalities in the country, more specifically in as far as the right to health is concerned and gender-based violence. And you see access to services that respond to GBV, like psychosocial support, documentation of that evidence, are not available, because if someone is raped or violated at night and they have to think of how they are going to access a health facility, the cost for public transport has really got high. It makes many people not want to visit a health facility at the moment. And that what really means is that there's no documentation, there's no collection of evidence, and ultimately that will lead to a miscarriage of justice, because that case will end up being as one of those cases that was never reported. The organization that I work with, Physicians for Human Rights, has also spoken to some of our network members who work across the country, and they've informed us that whereas there are so many cases that are being reported at the community level and within the communities, those cases are not being reported are the healthcare facilities for the same reasons that I've just mentioned. What I believe ought to be done by governments, and in this case, the government of Kenya, is there's need to adopt a comprehensive approach to healthcare. Yes, it's well and good to address COVID-19, but that does not mean other healthcare issues should be relegated or should not be addressed. And more specifically, gender-based violence is an essential service, whether in times of pandemic or when there's no pandemic. And it should be addressed from that perspective. In all the measures that the governments are putting in place to ensure the suppression and the spread of COVID-19, it should, at the core of it, should be a human rights approach. And that makes sure that the vulnerable people are catered for, all rights are not diminished or they are not relegated, and that will ensure that even as governments and everyone else tries to address this COVID-19 pandemic, then other human rights are also being taken care of. And the other thing that I just need to underscore is the fact that this pandemic, or in times of emergencies, cases of GBV go on the rise. And this is something else that has happened in Kenya whenever we have an emergency or a conflict situation, like the post-election violence that has taken place previously in Kenya. Those cases of GBV end up spiking. And more, and there are a myriad of reasons for that. But if during a session or a period where we refer to as normal, there is GBV, then whenever there's a pandemic, the cases are going to rise. And in a country that has so many inequalities and where patriarchy is entrenched, in a country like Kenya, then cases of GBV and the inequality and the power imbalances during such a pandemic where people are really confined, these cases are escalating day by day. And just to recap that, I am of the view and strongly believe that responding and addressing GBV should not stop because the government is addressing this pandemic. They should, and an acknowledgement by the government that these cases have gone up is not sufficient. They ought to put in place measures to ensure that survivors of GBV can report their cases, they are responded to, they can access the healthcare facility that they require, they can report these cases to the police, and ultimately these cases can be arbitrated to whenever, they can come to court and the perpetrators of these cases are prosecuted. Thank you.
Thank you very much for that excellent presentation. And I think very importantly, you highlighted the fact that the COVID-19 pandemic actually exacerbates existing vulnerabilities in societies. And this is really imperative for us to keep in mind when we think about creating sustainable solutions to the challenge and the human rights implications of the COVID-19 pandemic. So thank you very much for those excellent points you made, and also reinforcing the fact that there is a need for a comprehensive approach to healthcare service and the need for the government not to move certain issues away from national priority actions due to the emergence of this COVID-19, but rather to see the need to balance and ensure that all issues are prioritized within the context of this particular situation. So thank you very much for that excellent presentation. And I do know that our dear viewers would also be asking pertinent questions in this regard. We would now move on to the presentation by Dr. Adrian Njie. His presentation will be on the impact of COVID-19 on the rights of vulnerable communities in Uganda. Dr. Adrian, you have the floor. Thank you.
Thank you so much, Romola. And I've been listening to what has been presented before. So I work in Uganda, and my major area of work is on LGBT rights and also the rights of sex workers. So I can speak a little bit to vulnerability and also tie in with the last presentation around how COVID-19 is causing the vulnerabilities to worsen, so to say. So from the LGBT angle, I would start with the issue of susceptibility to arrest. So many LGBT people are being picked up and arrested in Uganda. And that as part of this whole COVID-19 response. So the situation in Uganda is that we don't have so many cases and don't have so many deaths. We are at about 100 and something. And the government wants to keep it that way. So they imposed a full lockdown on Uganda, meaning that we can't go in and out of the country, but also we cannot use public transport. Also, we cannot necessarily use private transport to get anywhere. And we cannot go to work, basically, because you don't have means of getting there, but also because most workplaces are currently closed. And now this is the biggest issue at the moment. What does that mean for someone who is gay, someone who is a sex worker, someone who needs to go, and there's a curfew starting at 7 p.m. in the evening. So that means you cannot move beyond 7 p.m. in the evening. And if you have a motorcycle, you can move beyond 5 p.m. in the evening. So for sex workers whose work is largely at night, so to say, they find it quite problematic because then they won't be able to work within the times they're supposed to work, but also they cannot congregate at the usual places where they congregate. And if they do that, then the police arrests them. That's point number one. For LGBT people, on the other hand, so the ban on the lockdown means they have to stay at home. Usually at home, the environment is not that nice and safe for them. Many of them had moved to shelters, and the government raided one of the shelters and arrested 23 people were found in the shelter. Right now, we are dealing with a case where we are demanding to have access to a group of 19 people who have been in detention for 45 days today. We won the case yesterday in the High Court. They gave us access to the 19, but giving you access by the court is not the same as getting access by the prisons authorities. So we are still trying to get access from the prisons authorities. Right now, our lawyers are at the prison waiting and demanding for access into the prison. Meanwhile, we are having meetings in different ends to make sure that this happens. Their trial is coming up on Monday, again, for the third time. The last 2 times it didn't take place. On Monday it's coming up again. And the question is, will they be brought to court? Prison authorities are telling us they cannot bring anyone to court these days. So what they've been doing is to use video link to link to the prison and the court. And that has been done only for the rich, not for the poor. Now, for our case, the people, the 19 are in detention in Wakiso, which is the district next around Kampala, basically. But the facilities are not the same as Kampala, meaning the courts don't have video link facilities to actually hold a trial. And so because of that, our clients cannot get justice because they can't be brought to court. The prison authorities are saying, if you make them appear in a courtroom with video link, we shall present them on video. The problem is, we have now to request that they move the hearing to Kampala, to a court in Kampala, which can actually hear the matter. And that's an administrative issue that's quite problematic. So justice has now become only for the rich who can afford it. If you're lucky enough to have been arrested in Kampala, then you can access justice. If you're not lucky enough to have been arrested in Kampala, it's difficult for you to get justice. So the people who have been released on bail these days have been the rich and privileged, but not the ones who are poor and marginalized. And that's a big issue. So for an average LGBT person who works at a hair salon, like most people do, the job is gone. And also, you cannot lock down. Many of us may perhaps be able to lock ourselves down to stay at home, but for people who work, who have to eat every single day, and this is the majority of Ugandans who have to get the food they eat every single day from working, the lockdown just basically means you are subjected to hunger, death through hunger, rather than death through COVID-19. And for some people, they may have to make the difficult decision of whether to die of COVID-19 or whether to die of hunger. And I know what many of them would choose to rather die of COVID-19 instead of dying of hunger. And then the police brutality is such a big thing, and I'm sure this is happening in most other countries. The curfew is enforced by force. The police arrest you if they find you moving beyond hours. And of course, this mainly affects those who are poor, more than those who are actually driving away. When we think about how the police enforces the law, people are being beaten. Peter traders are being beaten up every single day in Uganda because of the curfew. And so that's one of the biggest challenges. And of course, if you come to think of the right to health, that's another issue. Hospitals are now focusing on COVID-19, but also you have to get to hospital. That means you have to get a means of transport to get you to hospital. So without private cars and private tax and public transport, many people who have to go to hospital to access essential services cannot go there. This is not just for LGBT people and sex workers, it's basically for everyone. pregnant women have been given an exemption, but also you must be, I think, 7 months pregnant, not just pregnancies that are not at that level. So these ones can move, but others may not be able to move. So that has created a big public health crisis because people cannot be able to access services. And if you look at HIV/AIDS, for example, people continue to die of HIV/AIDS. They need their services. They cannot access these services because of their absence of transport. Organizations have been trying to distribute medicines to people. This has kind of worked, but as you can see, it's not something that would reach every single place because of logistics that have been involved in distribution of medicine. So health becomes a big, big concern when we are dealing with COVID-19. So we have issues of justice, we have issues of health, then we have social justice issues mainly concerning food. People have spoken about food distribution before. In Uganda, the government has been collecting food from people, but also getting lots of loans. Again, that has implications for us and the future from IMF and other places. So they're having a lot of money. But I think the distribution of food has become a very political thing. So who gets food and who doesn't get food is such a big issue. So many people who cannot access food, for example, sex workers have been regarded as how would I put it? They have been regarded as people who do not deserve food aid because of what they do. Remember, their livelihood has been taken away and then they cannot have food aid. So in many districts, the districts authorities are not giving food to sex workers until in one district, Gulu district, where sex workers threatened to reveal their clients in government, and now they're being given food, at least in that area. We have a case of a sex worker who was threatened by government authorities for having distributed food for sex workers, or for having convinced the district authorities to give food to sex workers. So food has become such a big political tool. Many people are not getting access to food during this particular period. I'll go back to the lockdown on courts. That's access to justice as a bigger issue. So apart from our clients who have been arrested, who are in detention, the government of Uganda continues to arrest people en masse. The major issues about COVID-19, was about decongestion. So prison schools were closed, university students were sent home, bars were closed, and restaurants to defuse the situation, to decongest these places. Now, prisons are some of the most congested areas in Uganda, and these have not been decongested. Now, what happened? The government released some 833 people from detention and then brought in immediately 2,000 others. Doesn't make sense. You release 833 and then bring in 2,000. And I think since the lockdown began, the numbers are now about 5,000. Never mind, Uganda has a very new prison for all these COVID-19 prisoners. And we have a very nice offense called doing a negligent act likely to spread the infection of disease. It means anything. So my clients who were arrested, we are found in a house, staying in a house, in a shelter. There were 23 of them. So that is an offense, because it's not an offense, but the police granted that as an offense because 23 people, that's a negligent act likely to cause infection of disease. Although there's nowhere where they say you cannot be so many, you have to be this number of people in a particular household. So all these are issues. Discrimination is becoming a big issue. Who gets access to what? Who gets access to services? Who gets access to justice? All those issues are happening. And so COVID-19, for me, is being used as an excuse to heighten homophobia. Already there's a lot of homophobia in the country. That is happening, and they're using COVID-19 as the perfect way. Instead of charging with homosexuality, with criminology against the order of nature, they charge you with doing a negligent act like to spread disease. It's being used to discriminate against sex workers. So it's now the magic bullet to anything. You do something, they bring you in and arrest you because of COVID-19. You write a book about Museveni and how greedy he is. Museveni is our president for 35 years or 40, I don't know the actual number of years. You write a book about him and say he's greedy, they're going to get you in, arrested, and they're going to say you're doing a negligent act likely to spread infection of disease. Where I don't know how those two connect. Also, because of Turkey, I've come up with many people who are being arrested during this period, also Turkey, and arraigned in court in a situation where they cannot really even take plea because of Turkey that has happened. So that's what is happening in the country. The economy now seems to be all about the rich, and the poor have been forgotten. The poor cannot move. The rich can move. The rich have stickers on their cars. They are regarded as essential. Lawyers, on the other hand, are not essential. And that means that access to justice is also not essential. So the government of Uganda last week made an order that only 30 lawyers out of the 5,000 we have in Uganda can be allowed to move and give justice on any given day. So 30 lawyers out of 5,000 lawyers, yet the police continues to arrest people every single day. And the courts are sleeping. There are only just a few courts, mainly in Kampala here, which are open for business, and that's only for bail and a few other applications. For most other courts, they are home sleeping. Violence has increased. Domestic violence has become a big issue back home, and women are facing the wrath of it, of course, at this period of time. And our president was on record one day saying, well, those are not issues that matter at this time. What matters are what he sees as big issues, I guess, prison and other things like that. So briefly, that's what's happening in Uganda, and also broadly, and also that's how the COVID-19 situation is worsening vulnerability for the mass marginalized persons in Uganda, including LGBT persons and sex workers. Thank you very much.
Thank you very much, Dr. Adrian, for really giving us, reflecting on the situation in Uganda and really giving us an insightful analysis of the various issues that are going on in Uganda. And you significantly highlighted the challenges in relation to access to justice, in relation to healthcare, in relation to social justice, food distribution. And you made very pertinent points, and in fact, sort of also highlighted the fact that the economy now seems to be rather for the rich, and we see issues exacerbating now given the spread of the COVID-19 situation, and how the politics of this situation is being used in a sense to exclude certain populations within the country. Thank you for that presentation, and I know that our panelists would, of course, our participants would have pertinent questions to ask you in this regard. Moving on now, we would like to hear from Mr. Barry Nibogora, who will be presenting on the response of the Global Fund and the OHCHR to COVID-19. Mr. Barry, you have the floor.
Thanks, Romola. It was quite interesting to hear the different presentations that are being shared by my colleagues. I offered to make some reflections on the global response, to COVID-19, based on what I've observed from the policies of the two institutions. So my presentation will be around, I'm not sure if I'm sharing the right one. Romola, you will have to guide me on this one. Am I sharing my screen?
Yes, we can see the screen. Thank you so much. We can see it.
All right, yeah. So I decided to look at human rights in the global response to COVID-19 and looking at the case of the Global Fund. The Global Fund is as an institution that is specialized in responding to pandemics, but also the Office of High Commissioner as a UN leading entity that respond or support countries to protect and respond to human rights. I will share my reflections in four sections or four aspects. Why do I focus on those two institutions? How the Global Fund is making the money work to respond to COVID-19, and what are the human rights considerations? What are the guidance that has been issued by the Office of High Commissioner for Human Rights? And what are we learning, and some concluding remarks. So why those two institutions? In fact, as we know, COVID-19 as a virus is a threat to public health, it's a pandemic, right? And we've had a number of discourse, political or otherwise, where people or leaders are encouraging national unity, but also that national unity needs to be supported by global solidarity, and some number of socioeconomic rights that have been affected by the crisis or the pandemic that needs some sort of support or global solidarity. As you know, socioeconomic rights are commitment of state, but number of states count on international solidarity for advancing a number of socioeconomic rights. And the right to health or responding to pandemics is one of the areas where countries easily advance the argument of limited resources, where international solidarity or international support is required. A human rights-based approach has been strongly recommended as one of the aspect or consideration that need to go into the response, and that's why we need to look at what is the guidance that the Office of High Commissioner is giving as the UN leading entity, that has the mandate and the core mission to promote and protect human rights. But as an entity that has the mandate to respond to pandemics, especially AIDS, tuberculosis, and malaria, the Global Fund has some expertise. And you know, COVID-19 is new to all of us. We are in uncharted water. We are trying to figure out how do we respond to that. So the Global Fund, that's why Global Fund and Office of High Commissioner were quite interesting for me to look at in terms of human rights consideration. So if I look at the Global Fund as kind of some sort of reminder or few context consideration, the Global Fund is that entity that was created in 2002 to respond to AIDS, tuberculosis, and malaria, because those three diseases, well, they are the most lethal, the deadly diseases that the humanity was facing. So Kofi Annan came up with that idea to put in place a partnership to respond to those three diseases. And it has raised a number of, a significant amount of money to give to different countries that are qualified as low and middle income countries. And an average of 4 billion a year is dispersed by the Global Fund to local experts to implement in countries using what they call principal recipient under the oversight of what they call the CCM, country coordination mechanism. So last year, they succeeded to raise $14 billion to be utilized for the next 3 years, 2020 and 2022. That was before the COVID-19. So the Global Fund implements the program based on a strategy that was adopted in 2017. Actually, we are in a conversation to revise or to renew the strategy for the next period. And that strategy has four pillars or 4 objectives. And one of the objectives is to protect and promote human rights and gender equality. In a nutshell, if you look at the governance or how does that strategy is being implemented, it's implemented by a governance and management structure, which has a global level and a country level. So the global level has some assurance structure, which is the Office of Inspector General, but they also have an operational structure, which is the Secretariat, different departments. And then the in-country structure is within the countries where the Global Fund implements its programs. You have the country coordination mechanism that play an oversight role on the principal recipient and sub-recipient, but you have what they call local fund agents. That is some sort of auditor that looks at how those resources are being used. And that's the process involve a number of partners. The country coordination mechanism involve private sector, the state representative, Ministry of Health, and civil society organizations that's working in health. And then they come up with a funding request that is supported by the Global Fund at the Secretariat level. Then you have an oversight structure, which is the board, has 3 standing committees, the Ethics and Governance Committee, the Strategy Committee, and the Audit and Finance Committee that oversee what the Secretariat is doing. We have some advisory structures which are technical partners. The WHO actually is part of the technical partner to the Global Fund. But we have also other advisory or some sort of evaluation structure, which is the Technical Evaluation Reference Group and Technical Review Panel. Those are the groups that look at the funding, whether they are relevant to the strategy of the Global Fund, and make comments for or recommendation for the Secretariat to disperse the fund. And the World Bank is the trustee, so that's where the money is. So if you look at the board, so it's a partnership that has different constituencies, including on one side, implementer group, those who receive, the countries that receive the money, and on the other side, the countries that give the money to the Global Fund. So that's the structure of the board, which has 20 members, 20 voting seats. And in each seat you have delegation of constituencies. I'm not going to spend more time on that. I just give you some sort of background why the Global Fund is important, because everything now is resources, is money. We live in a capitalistic world. If we talk about disease and pandemic, is that we need resources, and one of the things that COVID-19 has shown is the inequalities and the need for livelihood to be protected, and how the countries are struggling to actually adopt a response that can take into account the need for social distancing, the lockdown, and so on and so forth. A number of countries actually have failed. I learned that in Malawi, in fact, they have been opposing the intention of the government to implement a lockdown, because the country is not prepared, because people live on a day-to-day basis. There is no relief package that the country can get to give to people, the population, for their day-to-day life. So it's quite interesting the time we are living in. One of the presenters yesterday presented COVID-19 as a change, the same way that we talk about before Christ and after Christ. We are no longer going to use the same words. Now we talk about before COVID and after COVID. So how does the Global Fund work from the principle, from those structures to implementation? So you have the board that operates through different committees, standing committees, and then you have the secretariat. The secretariat approve requests from countries and disperse money to countries to be implemented by different actors. So the Ministry of Health or Ministry of Finance will be the one receiving the money to respond to health-related programs, but with an inclusion of human rights. So it's quite interesting because the Global Fund has that human rights protection mission within its strategic objective, and how does this work when it comes to COVID-19? So the Global Fund realized that this COVID-19 is disrupting their different programs, or the Global Fund programs in different countries, and they are better placed to respond to it based on the experience responding to HIV, AIDS, tuberculosis, and malaria. So, and they created, they responded in 3 ways. Through funding, they have adopted $1 billion through what they call flexibilities, and another package that is called COVID-19 response mechanism. But they also issued a number of policy guidance, a COVID-19 guidance, and also human rights guidance. Their response is also based on leveraging on their expertise. It's a partnership model, private, public, civil society, community partnership. And they are working with other partners to make sure that response is following a Global Fund model. Why? It's quite important to stop the pandemic, to preserve the gain for those other deadly diseases. You know, we talk about COVID-19 as a crisis, as a pandemic, but we forget that this is not the most deadly pandemic so far, right? It has been concentrated in China, Europe, and the United States of America. They have been the most affected, but COVID-19 threatens significantly low and middle income countries, where the Global Fund provides supports, hence the need for the Global Fund to step in and respond to COVID-19. And if you look at the recent modeling, the data are that COVID-19, if nothing was done, could cause 7 billion infections and 40 million deaths globally. And that's the worst case scenario. And if there are some measures that are taken, that scenario could go under half of the numbers that you have, 20 million deaths. But if you take aggressive suppressive measures, then you can bring the death to up to 1.3 million the next 12 months. So it's something that we need to respond to, but there will always be some people who will die because of a number of considerations. So how the Global Fund responds? So it's issued a guidance that is available on their website. And in that guidance, they allow the countries to use what they call saving up to 5% of the grant that they were receiving, the grant that countries that were receiving Global Fund money, to kind of repurpose or reprogram the money that they have up to 5% of the total grant. And as of the 2nd of April, 40 countries had already applied for that grant to respond to COVID-19. As of yesterday, that number was at 79 countries, and 322 grants had been dispersed. On the 8th of April, the Global Fund took 2 decisions. For business continuity. They kind of changed their operational requirement in terms of procurement, because with COVID-19 now, the supply chain, the procurement are disrupted, and they need to allow the countries for more delays. In fact, countries were supposed to pay what they purchase in terms of commodities within 90 days, but with the COVID-19, sometimes they are not able to do that. So there was a decision to lift that requirement, but also to do what they call portfolio optimization, looking at the funding that have been saved on one cycle to be used for responding to COVID-19 without necessarily having the board to approve. And then the last one was around quality assurance. In the Global Fund practice, when you are using their money, you have to do what they call pre-shipment sampling and testing the quality of the product that you are getting. And that can add up to 2 months of delay in terms of procurement. Because of COVID-19, there is a need for responding quickly. So that requirement was a bit removed. But that was around, if you look at the amount of money, 5%, it was around $500 million US. So the Global Fund voted another additional $500 million US to do what? To support, to give additional support to countries to respond to COVID-19. And those countries are countries that are labeled as low and middle income countries. Unfortunately, that facility of the additional facility that is administered by what they call COVID-19 response mechanism has not been used yet, because countries need to apply, and for countries to apply, they need to do it through the country coordination mechanism, have consultation with civil society, private sector, and those consultations require sometimes meetings, and those meetings are not happening now. So hence the consultation is something that needs to be thought through by different countries, how they can consult and meet the requirement of participation and inclusion for them to access to that money. So it's quite an interesting response and interesting thinking about how the Global Fund is using its partnership model to respond to the COVID-19. They have mobilized what they call a coalition of global institutions, which includes WHO, the World Bank, Gavi. Gavi is a global alliance for vaccine, and a number of key bilateral partners such as PEPFAR and USAID. But of course, the WHO remain a technical or scientific or guiding partner that give what is the minimum standard that needs to be met in terms of the response. But they are trying to have a coordination, because coordination is quite important. I will move to looking at what the Office of High Commissioner has done. So the Global Fund, in doing that, in designing their response, they have issued also a human rights guidance. So that's what is important and interesting, because they have that objective 4, which is around protecting and promoting human rights and gender equality. There's nothing new in the guidance note. The Global Fund human rights response is sometimes a bit tokenistic, because it's a good word to say, but when it comes to money, to the dollar sign, you don't have really a significant investment in true human rights programs. They have five programs or 5 aspects, that 5 commitments: scaling up the support to women and girls, invest to reduce gender and age-related disparities in health, introduce scale-up programs to remove human rights barriers to accessing HIV, TB, and malaria services, support meaningful participation of key populations, and network in global fund responses, and integrate human rights consideration throughout the program. What does this mean? When you unpack these commitments into programs, they have developed what they call minimum standard, which is non-discrimination, using scientifically approved medicine or commodities, not employing methods that constitute torture, cruel or inhuman, degrading treatment, respecting and protecting informed consent, and avoiding medical detention or involuntary isolation. When it comes to COVID-19, you can see how is non-discrimination being translated in terms of global fund programs. They kind of unpack that concept that everybody should access to testing facilities, care, including members of key populations. When it comes to scientifically and sound approved medicine, there's a number of disinformation and ignorance and fear. So the implementers and countries should use scientifically proven. And when we talk about evidence-based or scientifically proven decision making, sometimes you wonder whether what the countries are doing is really based on scientific evidence. Not employing a method that constitutes torture or cruel or human or degrading treatment. When it comes to COVID-19, this needs to be looked through in terms of mandatory quarantine, treatment center, what is the treatment with refugee camp, detention facilities, are we respecting social distancing, the homeless and the shelter, how are you providing facilities or employing methods that are not inhuman or degrading, how are victims of violence being treated or victims of discrimination, respecting and protecting informed consent and confidentiality. Needs to be interrogated when it comes to tracing method, right? Sometimes they disclose the COVID-19 status of people without necessarily having their consent for tracing purposes, especially. So there needs to be some sort of balance and see to what extent the confidentiality and privacy is being respected. Avoiding medical detention or involuntary isolation, or using that method as a last resort. We need to look at the measures of lockdown and quarantine and see how those measures are being done or decided based on scientific evidence. And right now, there is a question mark to what extent what is being used is scientifically proven. So there are a couple of human rights interventions that the Global Fund has designed in the context of COVID-19, or how do you adjust some training to not to be in-person training, and those are already in the Global Fund strategy. It's the same programs that UNAIDS is also promoting: legal aid, legal literacy, programs for prisoners. How do you think about those programs in the context of COVID-19? So a number of guidance has been issued. But when it comes to Office of High Commissioner for Human Rights, this is, I mean, as we know, it's a UN entity that leads on human rights. It has a very broad mandate, and in carrying its missions, there are a couple of considerations that the office needs to take into account: protecting the most vulnerable, the most pressing, focusing attention to those who are at risk, paying particular attention to all rights. And in the context of COVID-19, the office has issued a very detailed and broad guidance for a number of areas: access to health care, emergency measures, leaving no one behind, housing, people with disability? What does it mean? What the state needs to do? And those obligations are not new obligations, but they are obligations that already exist that need that are a bit adjust to the context of social distancing, lockdown, quarantine, or the requirements that that are justified by the current context. So, so as I reflect, as I look at the response that has been designed by those two institutions, there are 4 or 6 points that I wanted to make. First one is that the Office of High Commissioner has got a broad mandate in terms of human rights, a mandate that is broad than the one that the Global Fund has. But there needs to be a collaboration between those two institutions, because not only the indivisibility of rights, but also leveraging on each other's strength, right? The Global Fund has got significant resources that you don't have within the Office of High Commissioner. But the Global Fund decision-making process or inclusion in who to talk to when they're designing the programs, they never go to the Office of High Commissioner to understand what are the human rights indicators, how do you put the dollar sign to the rights. And that's, there seems to be some sort of disconnect between the ambition and resources. Human rights seems a nice term or vocabulary to use within the Global Fund, but when it comes to the technicality and the translating those commitments to programs and funding, there is something to improve. There is a discourse around national unity and global solidarity to respond to COVID-19, but this needs to be translated into concrete collaborations and leveraging on resources, even at the global level. Thanks. So those are my last points, and thank you. I'm sure I went beyond the time.
Thank you so much, Mr. Berry, for that excellent presentation. And just to emphasize that Mr. Berry is a member of the Ethics and Governance Committee of the Global Fund, which is a standing committee of the Global Fund Board that develops policies and ethical standards, as well as oversees the governance and management structure of the Global Fund to fight AIDS, tuberculosis, and malaria. And congratulations on your very recent appointment on the 11th of May, 2020.
Thank you.
And for your excellent presentation as well in this context, reflecting on the Global Fund and the Office of the High Commissioner of Human Rights in relation to COVID-19. Thank you so much. And once more, many thanks to our excellent panelists for those insightful presentations. I do see that we have Miss Lynette Dutoit, who has a pertinent question to ask one of our panelists. And I'll kindly like to call on Miss Lynette Dutoit to kindly ask a question. Miss Lynette?
We can't hear you.
Yeah, thanks so much, Romola. So my question goes to Barry. Yeah, and I mean, we've heard our panelists, and you know, the common thread that we hear in the Gambia, in Kenya, in Uganda is the fact that our governments are taking measures and they're doing what they can or what they think is the wisest and best approach, but very often it's not necessarily a human rights-based approach when it comes to accessing healthcare services for vulnerable groups. So, so my question is really, what is the measure of authority that the Global Fund could actually exert within countries that they partner with in order to, and more than just issue guidelines on what it means, what a human rights policy would look like or would mean, but to actually have a measure of influence about the actual policies that are adopted, and whether or not you know, victims of GBV would have some way or would have some exception to be able to access healthcare facilities, and there is some leeway for an organization and a development like that.
Thank you very much for your question. Mr. Berry, I suppose this question goes to you.
Do you want me to respond it now directly?
Yes, please, you can go ahead.
Thank you. Thanks. You know, there is the real politics it plays when it comes to resources. You know, the countries have this sovereignty that they always display when it comes to what they do within their territory. The concept of sovereignty has been discussed, but you also, when it comes to socioeconomic rights, when you are looking for international solidarity, you need to get it within some level of responsibility, right? You need to implement your programs with respect to human rights. So when it comes to Global Fund, I find Global Fund having quite a leverage because of the resources, right? The money that the hands that gives the money has got some ways of exerting pressure for the countries to do the right things, right? Especially when it comes to violation of human rights. There's a commitment within, or an obligation of the Global Fund not to support programs that violate human rights, that does not protect or promote human rights. So the possibility that I see and that has been used is, how do you report and make complaints? There is a couple of ways of engaging the Global Fund, because sometimes the state does not give the true information, the true reality of what is going on the ground. So what happens will be either there is a line that has been designated for people to complain directly to the Global Fund, to the Office of Inspector General, that is called I Speak Out. So whenever there is a violations that you see involves resources or entities that are supported by the Global Fund, most of the time the healthcare, and in the case of Kenya, actually you have Kenya as one of the beneficiaries of the Global Fund money. So that can easily be reported, and action will be taken. So the way it works, so the Office of Inspector General receive the complaints and talk to what they call the country portfolio manager. The country portfolio manager is the one who signed the disbursement of all those resources that go to country. And so, I will imagine if there are some concerns around a situation, documented situations, and it's raised by the person who is going to sign your next check, you will have to think twice before not complying with the measures that are required to respond to those concerns and take actions to stop the violations. So that's what I would say. So there is a leverage. They do not have policing authority to countries, but as you know, when countries need resources and the person who is giving you resources, there is a nice way of using that leverage, that funding position to get things done.
Thank you very much for your excellent response. Very well noted, and I suppose this sort of responds very insightfully to the question asked by Ms. Lynette Dutoit. Thank you so much for that. I do see that Ms. Alette Wamba has a question, and if you could kindly perhaps unmute your mic and also show us your video so that we could hear from you. Thank you. Ms. Alette, you have the floor. Okay, I think there's a technical concern there. Perhaps I would, if you would allow me, I could possibly read your question out so that we could have one of our panelists or all of our panelists respond to this. I think the pertinent question you raised is in relation to the fact that we see that sexual and gender-based violence has really been a significant challenge even prior to the COVID-19 situation. And increasingly what we're seeing is that there is a need for more significant response within that context. And I think you're trying to also know what new measures can we take to really address these issues, perhaps innovatively, beyond what we currently have or what we've currently been doing before, to ensure that we respond to this issue. And I think that your question is important also in light of the fact that it resonates across board and in relation to various issues that have been discussed by our panelists, and perhaps as a way of also having our panelists in 30 seconds or in about a minute, given our time, respond to make us perhaps understand what innovative ways or measures do they think we should take in ensuring that we respond to these issues, even in this COVID-19 era, but then also beyond the COVID-19 era, given that the COVID-19 situation has really showed us some of the gaps in protection at national and international level. So perhaps call on Dr. Adrian Juko if you want to start us off, and we then would go to perhaps Mr. Berry, if you would also take the floor after Mr. Essa, and then we move on to Ms. Naitore. Thank you.
Yeah, thank you, Romola. For me, I think generally speaking, this is a different time from the other times. Things have been happening before, yes. Lots of issues have been happening before. But for me, I think why this period is unique is because it brings in limitations on basic rights. And that's important, that if basic rights are limited, for example, the issue I raised around the right to health, the right to health, the right to a fair hearing, those are important rights that shouldn't actually be limited. In fact, in our constitution in Uganda, the right to a fair hearing is non-derogable. You can't derogate it from this time. So for me, I think when times become, if things become the way they are right now, that's when we need everything to be done. Activists cannot sleep at home. People who are working on these issues cannot sit down and simply let this continue to happen. So we need to stand up and engage the best way that we can, and see that during this period, at least, we have a reduction in the violations that have come up as a result of COVID-19. Not forgetting, again, of course, what has been happening before, and we continue using the same mechanism that we've been doing before.
Thank you very much for your excellent response to this. Mr. Berry, please, you have the floor.
Yeah, it's a tricky one. It's a tricky question. I think, it depends on how we want. I mean, COVID-19 is something that has brought, it's something new in our life, right? Nobody was expecting to be locked at home and spend 24 hours indoors. And for a number of people, home may not sweet home, right? I understand that even those who are, there's a conversation going on here in South Africa where they have reported an increasing number of domestic violence or gender-based violence, because people are now stuck together for 24 hours, right? You may have commitment to your partner, but you were not expecting to spend 24 hours with that partner, right? You have work, you have to go out and then spend a few hours with that person, and then it all goes well. But now you are locked inside and you have 24 hours, and a number of attitude and things start coming out. For me, it's the violations, gender-based violations gender-based violence is something that a number of countries have tried to address in a particular way during this context, because of the contact and the time that people spend together, and the secondly, the mental health issues, the fact that you are locked down. There are a number of people who have different ways of responding to that. I wouldn't see it as an excuse not to report and address and investigate and work on those. And it's quite challenging because of also the possibility to report depends on the trust that you have in the system that something is going to be done. In a number of countries, gender-based violence is not reported. It's 1 in 9 cases, even here around in South Africa, that they report those cases. So it's a tricky situation. We are expecting to see an increase in violence, but the situation, the COVID-19 should not be, in my view, an excuse. There need to be some innovation in a way that people are able to safely report, and a number of organizations have come up with innovative way of ensuring that there is a response, like hotline, WhatsApp, anonymous ways of reporting and responding to that, right? In France, in South Africa, they've created some shelter where people can, even when you are walking and going to police station to report, you are not required to produce a permit. So when you go to police station, you don't have to do that. But in other countries that are a bit advanced, in France, they are using now hotels as shelter for those who are victims of domestic and gender-based violence. So it's quite difficult, in the country's commitment to responding and addressing that violence make a difference. And it's a particular time, it's a very unique time where really the increase in violence is expected for a number of those reasons.
Thank you very much for that insightful response, Mr. Berry. We move now to Mr. Essa. Mr.
All
Essa.
right. Sorry, let me put on my video. Okay, I think I'm here now. I think this is a very important question because, as Mr. Berry rightly said, this is something that is also underreported, especially in the case of the Gambia, where issues of gender-based violence have been underreported and have been neglected. And during this period, it's important to also know that people tend to ignore the issue of gender-based violence in the Gambia. In fact, I don't think people are even kind of creating a correlation between COVID-19 and gender-based violence, whether it in fact has an impact on gender-based violence. We just have few women's rights activists that are at least making this known out there that COVID-19 has a direct correlation or impact on gender-based violence. And thankfully, the United Nations UNFPA has conducted a study, or wrote at least a mini study, should I say, or an investigation or whatever, on the issue of gender-based violence in the Gambia during COVID-19. And part of its recommendation is because one, they looked at the issue of gender-based violence, how COVID-19 could impact on it, and also they tried to come up with policy measures. This is just this year, May 2020, policy measures that will be needed in addressing these issues. And one of them is to provide social support to women and young girls that are kind of restricted in terms of their movement, because they cannot move out to feed food for themselves and also take care of some of their needs out there. As a result, because they are restricted within households, they are prone to being victims of gender-based violence. So one of the measures also is to ensure that there is international collaboration between international bodies, especially those that work on the issue of women's rights, and the government, to ensure that there is also sensitization about on the risk of the virus, and also the potential impact it could have on the rights and health care or health of women. This is something that the UNFP has recommended, and I also think that is something that could be done, especially when it comes to issues of sensitization, because I think the biggest problem here has to do with the level of awareness of the people in knowing fully well that COVID-19 has an impact on women, because many times what we think is that in that country, women are not mostly affected by some of the problems that we have in society, and as a result, they should not be given that attention. Many times we think that it is men, okay, they are the ones who are working out there, who are going to do something for the family, they're the breadwinners, they are being stopped, their movement is being restricted, employment, jobs are lost. As a result, they are the ones that are highly affected. But in reality, women too are affected, especially when it comes to gender-based violence. As he said rightly, Mr. Berry said, when you have 24 hours now living together in one house, there is tendency for at least that level of violence to come, because when the man goes out, at least sometimes we understand the problems might be minimized. But when you are in the house 24 hours, you're not going anywhere, there's a tendency that whatever the woman does could be considered offensive by the man, and this could result in issues of gender-based violence. So in the Gambia, I think the level of collaboration between the government and also civil society organizations, more especially and international bodies, will be very good in addressing issues of gender-based violence, not only during this period, but as you rightly said, after COVID. I think that is very essential.
Thank you very much for that brilliant point you've made. We'll now move on to Ms. Naitore.
Thank you, Romola. And I totally do agree with the rest of my colleagues and panelists around this issue. However, what's currently going on in as far as gender-based violence is concerned is symptomatic of our normal sort of lives, normal quote unquote sort of our lives, because even whenever there is no pandemic, cases of GBV are still quite high. And just to mention, like in many countries and also even in Kenya, and there has been that tendency not to address these cases, or they have not been given the requisite attention or priority that they do require. And now when a pandemic like this happens, then even the shift goes to other things, and some of the first issues or aspects that are taken away include services that respond to SGBV. And this is something we've seen, even healthcare professionals who respond to SGBV cases in health facilities have been deployed to other units or to other departments that are addressing COVID. Therefore, for all of us who are working in this sector or even on other human rights issues, the key concern is if the issues that are very particular, or the issues that are of our concern are not addressed even when there's no pandemic. In terms of pandemic, then they'll be at the bottom line in terms of the hierarchy. They'll not be given that preference. So we need to continue exerting pressure on our governments and over again, ensuring that these programs or services that address gender-based violence are prioritized and are well budgeted for. And also there are available mechanisms for survivors and victims to continue reporting and also to access the requisite services that they require. We do have a hotline in Kenya, and I'm happy that it has been sensitized, and many people are in a position to call that hotline and report those cases. But the big issue is once you report and your case is recorded, we do not have facilities or people who can come to where you are and perhaps take you to the hospital, because if it's at night, no one will do that. And also you as a person, you've reported via hotline, you've called and they've recorded your case and they've given you some of the options that are available, but how do you get to the hospital? How do you get to the police to record that case or that violation? It still remains such a huge gap. One of the key advocacy measures that we need to continue advocating for and putting all our efforts on is safe spaces and shelters. And there have to be shelters that can work for victims and survivors of sexual violence. A shelter should be comprehensive enough to have all the services that survivors require, the medical, the psychosocial, reporting of those cases, the legal aid that they do require, such that by the time they are leaving that shelter or a safe space, their case maybe is already in court and the prosecution is going on. So for me, what all this alludes to is the fact that we still have a lot of work to do, whether we are in crisis or not. There's still a lot of work to be done, and we cannot afford to go slow at this point. It gives us an opportunity to continue advocating and to continue ensuring that our government use a rights-based approach in all the measures that they're putting in place to address COVID-19. Thank you.
Thank you very much, Ms. Naitore. And I think on this brilliant note, I'd like to thank you, dear participants and viewers, for your excellent participation. On behalf of the technical team, I'd also like to thank our seasoned panelists for their excellent presentations. In closing, please kindly take some time during the week to visit the Center for Human Rights website to watch the recording of this and other pertinent discussion forums. And please do feel free also to share the web links with your friends, with colleagues, and other relevant stakeholders in your countries and your regions so that they can also keep informed and join us in the discussions. Special thanks once more to you for your very kind participation. And I think it would not be appropriate to end this particular session without actually thanking those that really made it possible. And this presentation was made possible by Ms. Yolanda Boyson, who is the manager of the Communications and Advocacy Unit of the Center for Human Rights, and Ms. Tiruna Naido, who also works for the Communication and Advocacy Unit. We especially thank them for organizing the discussions, for really leading these impactful sessions, and for really pulling us together in this pertinent conversations. And many thanks as well to Mr. Tomiwa Ilori, who is involved in the organization of this series. So once more, I'd like to thank everyone for being part of this. To you, dear participants and viewers, and to our friends, please remember to kindly follow the Center for Human Rights on all social media platforms to keep informed on the weekly discussion forums. And we hope to see you next week for another insightful session. Thank you very much, and do have a good day.
Thank you. Bye.
Thank you. Bye.
Bye.